Started. Good afternoon, OR Today. Thank you all for participating in today's webinar. During today's webinar, all lines will be muted, but you can submit questions during the presentation by using the questions feature on the dashboard on the right-hand side of your screen. If you have any difficulty, please email us at webinar@mbpublishing.com. Earlier today, a webinar workbook was emailed to pre-registered attendees. If you did not receive a copy, you can download one now under the handout section of your dashboard. OR Today is happy to provide a certificate of attendance for your participation today. A survey will appear on your computer screen immediately following today's presentation. You must complete the survey to obtain a certificate, which will be emailed on or before December 10th. If you do not receive a survey, again, email us at webinar@mbpublishing.com. OR Today would like to thank our sponsor, the Competency and Credentialing Institute. CCI is a leader in credentialing, nursing competency assessment, and education for the perioperative nursing community. CCI has developed and maintained the CNOR, CSSM, CRNFA, and CNSCP credentials for more than 35 years. The organization currently certifies more than 33,950 nurses, and CCI supports its credentialing programs with a suite of publications, exam preparation resources, certificate programs, and CE offerings, including those being offered at the OR Today Live Surgical Conference. You can visit them at www.cc-institute.org for more information. Okay, OR Today is proud to have CCI as an official partner of our OR Today Live Conference and Expo. Save the dates, August 28th through 30th, 2016, to join us at the Hilton Oak Brook Hills Resort in Chicago, Illinois for our next surgical conference. Learn more by visiting ortodaylive.com. Our presenter today is Mr. Jim Stavinsky, Director of Credentialing and Education at CCI. Dr. Stavinsky has in excess of 25 years experience in the OR. He has 18 years of management experience in the perioperative nursing, and until 2011, he was the Director of Surgical Services at the Boise facility of the St. Luke's Health System. His education includes a Diploma of Nursing, a BSN, and MSN from East Carolina University, and a PhD in International Health Research. Jim, you may begin whenever you are ready.
All right, thanks, John. And thank you all for attending this webinar. I'm Jim Stavinsky. I work for the Competency and Credentialing Institute. Some of you may be familiar if you hold one of our credentials. And my presentation today is so you want to be, or you are, an OR manager. So along with the thing about I work for CCI, I do have to tell you this, a disclosure statement. If this is anywhere on your eval about potential conflicts of interest, I'm employed by the Competency and Credentialing Institute. We're a nonprofit, and our main line of business is we do nursing certification and education. One of the certifications that we offer is the CSSM credential, Certified Surgical Services Manager, and that will be mentioned in this presentation, so I do have to declare that as a potential conflict of interest. And I do have about an hour of material. We will hold the questions to the end of the presentation, and I will stay on and answer them at that time. You do have your chat window in the bottom right, and you can put the questions in there, but we won't interrupt the presentation to take questions during the presentation. So here are our objectives. I want to familiarize you with the skills and training needed to function effectively in the OR manager role, talk to you about the benefits of a surgical services management training program with particular emphasis on what is offered by CCI, and then finally at the very end of the presentation tell you how the CSSM credentialing program, the certification program, validates your expertise in surgical services management. So I'm going to give you a fair amount of background information at the beginning of this webinar about how how people come into the OR, specifically managers, and how they get to become leaders and managers in the OR. I'm going to use the terms interchangeably. I'm talking about, in general, the nurses who work in the operating room setting, and they are the ones who supervise the work of the OR. I know academically there's a distinction between the term leader and manager, but the people who are in charge and make sure that the daily work of the OR gets done, that's the focus of this presentation. So as I said, a fair amount of background information in the beginning, some historical context, and then we'll get into the actual management training programs, certification, things like that. We do offer educational materials at CCI for surgical services managers. And those materials take the form of self-paced learning and also live presentations, as we did last year in Las Vegas at OR Today Live. There are, in the current materials for, it's called the Fundamentals of OR Management or Surgical Services Management, there's 7 modules, about 400 pages of text. And one of those is termed operational management, and this definition comes from that module. This really is the essence of what we do in the operating room. Operating room management is the art and science of maximizing operational efficiency with the resources you have, the number of rooms that you have. When we boil it all down, that's the essence of what we do. I should tell you a little of my background because I'm a diploma nurse, and that's how I got my start. I am the last male graduate of Toledo Hospital School of Nursing in Toledo, Ohio. There were 2 classes after mine, but then they shut down the school after 92 years. So that's how I got my start in nursing. And so that influences my perspective on this whole thing about education and training. So shortly after graduating, I worked for a couple years at Toledo Hospital as a staff nurse, and then I joined the Navy. And in the Navy, you quickly get pushed along. The only way to have a career in the Navy and progress and be promoted is you very quickly have to get into management and leadership functions, and you're actually evaluated on that. So most of the time I've spent in the operating room has been in some sort of leadership position in anywhere from 2 rooms to 17-room ORs. So much has changed over the years, and so the single biggest change that I can tell you about, let's go back one slide, sorry. The single biggest change is now the emphasis on finance and operational management. This quote comes from OR Manager, the October 2014 issue, and the author there said that we need to see ourselves as owners of a business. Even in a medium-sized OR, you are bringing in millions of dollars of revenue every month, and you are incredibly important to the financial well-being of your facility. So we need to think of ourselves as a business. I think early on when I came into the operating room that the whole thing, it really predominated more on nursing than it did on business. And I would say this is the single greatest change to date, is a far greater emphasis on the financial functions that happen in the operating room and their importance. So let's go over some demographics of what our community looks like. And we actually have some great information on this. OR Manager surveys people every year, and they've done this for 20 years now. These are the results from their 2015 survey. They survey leaders and managers in the operating room and ask them a series of questions. And some of the questions, like the demographic ones, they have asked for years. So we are a very mature community. If you look at the age range of the respondents, over 60% of the people that answered this survey are over age 50. And while this may not be representative of the entire community, it's been remarkably consistent over the years. And I think all of us know that we're a pretty mature group that manage and lead in the OR. And it's also consistent if you look at the other table. When it says when do you plan to retire? Of the people that are managing ORs right now that answered this survey, nearly half of them plan to retire in the next 10 years. And that does match up very well to what we know about the age range. What we also know is that we have a lot of responsibility. And this is the other thing that becomes clear when you look at the OR manager surveys, is that we tend to accumulate more departments and we supervise more people. As this is a trend, and over the years we tend to take on more and more responsibility. They take out other layers of management, and we tend to get more departments under our supervision. And it's not unusual to have 6, 8, 10 direct reports, central processing, the pre-op clinic, the PACU, not unusual at all that all of these fall under our direction. The other thing that in the 20 years of the OR manager survey that's become very clear is the education level for those people who manage an operating room. That is steadily going up. If we look at this graph, 78% of the people that answered this survey have a bachelor's or higher, and we are getting close to 50% of the people that manage operating rooms now have a master's. And that could be an MBA, an MHA, many MSNs, but graduate level coursework, a graduate level degree, we're finding increasingly as a hiring requirement. And we have a fair amount of information about this community in the statistics that we keep at CCI, and this is what we see. Our findings are consistent with this. It may be possible to take a position with something less than a bachelor's, but it's pretty clear there you will be pushed along rather quickly to up your education level. And this is just the current community as best we know from the results from the OR manager survey. So let's talk about the current state of nursing in the operating room. And you will see on this image, I have a number of these images in the presentation, a nice visual break. These come from the National Institute of Health in their public domain. So when we talk about the history of nursing, I think it's nice to see images like this. So let's talk a little bit about the history of the OR and OR nursing. And Jamie, at this point, I do have a poll question. And so Jamie is going to lead us through the poll question, a little bit more information to inform our presentation.
Absolutely, Jim. Right now, the attendees should be able to see our poll question, which is, what is the highest educational degree that you hold? Attendees, please select one of these options: the Diploma of Nursing, Associate's Degree, BSN, or a bachelor level degree of another field, MSN, MHA, MBA, or another master's degree, and the last option being the doctoral level degree. It looks like we have about 64% of our attendees have voted, so I will take this time. As Jim mentioned, we're holding all questions to the end of today's presentation, but you're welcome to submit a question at any time using the chat feature or the question feature on your dashboard. We'll be happy to address those as time permits, or if needed, we'll send them over to Jim after today's presentation. Does look like we have the majority of the answers. Let me go ahead and launch the results so we can share them. Jim, it looks like 55% of our attendees today are holding a bachelor level degree of some field. The next is going to be 21% with an associate's degree, 17% with a master's degree, 3% for a diploma of nursing, and 3% for a doctoral.
All right, thanks, Jamie. So if we add this up, if we add the bachelor's and master's, even though the proportion is different, we have 72% of the people on this call who have a bachelor's or higher that are managing operating rooms. And that trend is very clear. If we looked at the data from 20 years ago from OR manager, there were very few people that had a master's degree of any type, and that is increasingly, that's changing, and more people are either being required or choose to do graduate level coursework sometime during the course of their career. So the point of all of this is that there is a variety of educational paths. Even if we look at this small sample of the people that are on this webinar today, and we find this when we talk to people that are in the operating room, and I ask them, what is your education level now? There are all kinds of combinations, a BSN followed by an MSN. There are many people who they have some sort of nursing degree, pre-licensure education that brought them into the profession, but then they go on to get an MBA. There are some people managing operating rooms right now that are not nurses. The one thing that we do find is there's not a set curriculum. Aside from your formal academic education, the other thing that we find is there's not a set curriculum that you did. It's not widely agreed upon about what the educational course you should take in order to effectively manage an operating room. That's the pattern that we see. So let's explore that a little more. Here's a very typical career course. A person starts in the operating room, and perhaps they did a year or two working another unit in the hospital, say a med-surg ward, and then eventually come into the OR as a clinician and work in the operating room, and some perhaps 15, 20 years into their career and hadn't really given a lot of thought about getting into management. And then there's a retirement. For some reason, people leave the organization and they get approached about going into management, and they do. And the other thing that's common here is that they haven't really planned it out and prepared for it, but the opportunity presented, and then they went into management. Not an uncommon course at all, but not always well prepared. And because we don't agree upon what the educational course is, not everyone is set up for success. So I refer to this as the Spartan Approach. It's cruel, and sadly, some people don't do well. So they agree to go into management in the operating room, and they don't fare well. It's frustrating. They don't get the results that they want, and they're not successful. And so it's a cruel process where we kind of narrow the field down to the people that can eventually be successful in managing an operating room. And we think at CCI, we think there's a better way to go about this. And that's really the crux of what I like to talk to you about. So there are some long-held assumptions about management in the operating room. And so let's cover those. And you probably have other ones, but see if any of these resonate with you. Number one, that you must be a registered perioperative nurse to manage an operating room. We've said this forever. Number two, that you have to have a clinical background. If you're a nurse, you've got to have a clinical background, because obviously our work is so unique that you have to have done clinical in order to do a good job as a manager. Number three, that a good clinician, if you can function well and you're a good clinician in the operating room, obviously you'll make a good manager. And I would add a fourth one here that I didn't put in my bullet points, but an assumption we make right now, and it drives a lot of our educational programs, that having some sort of graduate degree will make you a better manager in the OR. There's a lot of reasons why we push to this level of education, but I will tell you that the evidence here is not great either. All of these assumptions are now being challenged. And a lot of the things that we had held to be true, or we seemed convinced of for many years about what it takes to manage an operating room, all of these things are being challenged. What do we know about this whole situation? There's probably much more that we don't know than what we do know, but there's certain things that we're certain of. What is going on in the management ranks in the operating room? There are parallels to the larger perioperative nurse community, which I'm going to speak to here in just a bit. At present, just as there is not for operating room clinicians, there is not a widely used core curriculum for OR management for nurses. Many of us learn the job in that rather cruel Spartan process of working our way to becoming proficient as an OR manager. We learn as we go. A lot of it is on the job. We develop our resources to aid us in our work. Some of us turn out to be quite successful. Others aren't. Some have a relatively short career. But again, there's not a consistent way that we bring people into the management ranks in the OR. So here's what I know at CCI. There's very little research into what methods of education and training are most effective in how you develop leaders for the operating room. There's also little research-based evidence on which healthcare profession is best suited to lead an operating room. And in the absence of evidence, there's little in which to base an argument for or against a particular educational course or a particular degree. CCI has a big interest in this question. We certify operating room nurses, but many of the people that hold our certification, there's over 35,000 people that are certified with us. Many of them, a disproportionate amount, are managers, leaders of some sort or another in the operating room. And we have long been asked to put together a certification exam specific to OR management. All certification exams, whether surgical techs, anesthesia techs, operating room nurses, critical care nurses, they're all based on one thing, if they're an accredited program, and it's called the job analysis, or a role delineation study is another name. If you have an accredited certification program, you have a job analysis. So as a prelude, as we considered whether we should have a certification exam, we did a job analysis of the work of managers and leaders in the operating room. And so a job analysis is designed to obtain descriptive information about the tasks that people do in a given role, in this instance, OR managers, and the knowledge that you need to adequately perform these tasks. To the best of our knowledge, nobody had ever done a job analysis previously for the role of a nurse manager in the operating room. A job analysis is scientifically rigorous, resource intensive, they cost a considerable amount of money, and they involve a nationwide sample of hundreds of OR managers and leaders, and we did such a survey in the year 2013, and the work continued into 2014. And we surveyed hundreds of managers across the United States, and we got a representative sample of the entire population. And here's what we found. There are two distinct skill sets for nurses in the operating room that we have studied. We've studied CNOR, which is nurses that are providing clinical care, and we've also studied those who do management tasks. They are two distinct skill sets. There's no common elements between the two. If you divide up the material into the major subject matter areas, there are no two that are common to both of these, the CNOR and the CSSM job analysis. So our old assumption that you had to be an excellent clinician in order to be a good manager in the OR, we found no basis to support that. And the other thing that we found is the pace of change is just incredible these days for people doing management in the OR, and the job analysis needs to be repeated at a shorter interval. So we will repeat this job analysis in the year 2016. So you may actually see something in the mail where we ask you to participate in a survey. That would be part of this job analysis. So we survey people nationwide to come up with these findings. So in this whole thing about how do people learn and acquire skill, how do they become a good manager, theoretical frameworks, and please don't worry, this is not going to be a weighty academic discussion on theoretical frameworks, but they help to give you some perspective. Two that I like to use to look at things like this, Patricia Benner's Novice to Expert Theoretical Framework about the 5 stages of skill acquisition is one way to look at it, but I'd like to talk about another one. And it's called Benner's 3 Apprenticeships Model. And I have a diagram of it. This is my rather crude Microsoft PowerPoint drawing. Patricia Benner, in addition to the work she did mainly in the mid-'80s about novice to expert, she also wrote another book in 2009. She was one of the 4 authors. She was the lead author. And it's Sutphin, there were 2 other authors. It was called Educating Nurses. And the premise, or what they put forth in that book, was that in order to enter the nursing profession, or any subspecialty of nursing like perioperative nursing, or even a smaller subset, management in perioperative nursing, there are 3 apprenticeships or 3 spheres that you have to navigate and complete successfully to be fully integrated and be successful in the profession. And so one of them is the intellectual training, that there's a foundation of knowledge that you must have to be successful. That is a big difficulty for us, not only in perioperative nursing, but also in management, because we've never settled what that body of knowledge is. Number 2 is the skill-based apprenticeship. That, too, is difficult for us in the operating room and the management ranks, because if you're in a community hospital and you're the director of the OR, there may be nobody else at that hospital that knows more about how to run an operating room than you do. So it's hard to have a mentor or a preceptor when you agreed to take the job because someone retired. You don't have a wealth of management experience, and there's no one else at the facility that has more than you. So we do a very good job when we bring clinicians into the operating room because we've long used precepted learning experiences, but we don't do a good job of this with when we bring people into the management ranks. And then finally, the 3rd sphere is to integrate your practice to be socialized into the profession. If you've survived for any period of years in the operating room, you've somehow worked your way through this and you are integrated into that part and know the social norms and things of the profession. But we have a lot of challenges in intellectual training and the skills-based apprenticeship. So some background about the history of perioperative nursing and management. Some historical background. For those of us who are diploma nurses, this will especially ring true. In 1949, there was a survey done of all the nursing schools in the United States, and at that time, there were just under 1,200 nursing programs. And at that time, this is immediately after World War II, there were 111 university schools and nearly 1,100 diploma schools. And there were very few, if any, associate degree programs at that time. And so when they published in 1950, this is where we stood. So at that point, for those of us who are diploma grads, the one key difference between our programs and other programs is we had experience in the operating room. That was integral to our program. So we, in 1949, 1950, we had the vast majority of all the nurses in the country were attending diploma schools and had a background in the operating room. And then that changed. And now there are only about 2% of all the people that take the NCLEX each year are from a diploma school, and the associate degree and the BSN nurses get very little exposure to the operating room. Not unusual for an associate degree nurse to have only a day or 2 in the operating room. And this has meaning for our profession. There are some that have said the 1880s and 1960s are really the golden age of OR nursing, perioperative nursing. In the 1880s, perioperative nursing, then called OR nursing, was the first recognized subspecialty in all of nursing. In the old Florence Nightingale model, nurses were trained on the ward in the operating room, and it wasn't distinguished as a specialty. In the 1880s, 1890s, it became a specialty, the first. And until the end of World War II, work in the OR, training, education in the OR was integral to nursing education. Once the associate degree programs began to take off, the diploma programs declined precipitously. And so now there are only 17 states in the union that still have diploma programs. And what we found as the diploma programs went away, there was a real decline in using the ORs as clinical sites and the exposure to the OR. And then what we came to is then we went from having the operating room be an integral part of nursing education pre-licensure. For the people that came into the OR, instead of everyone having a background, only the people that came to work in the OR then had much experience, and the training then was taken over by the hospital. And so the whole occasion changed. One of the reasons why we have staffing shortfalls in the operating room right now is the fact that there's very little pre-licensure exposure to our subspecialty. So we were the first recognized subspecialty, and then soon thereafter a debate started. Is perioperative nursing really is it a technical skill? Is it really nursing? And eventually we got to the point that operating room was de-emphasized in nursing curriculum, and not unusual at all that in many nursing faculties there may be only one or perhaps no nurses that have perioperative experience in the faculty. The employer took on a much larger role, and so the whole thing about training for the subspecialty was decentralized from all nursing schools down to the individual facility. And we never established the body of knowledge that you needed to lead and manage perioperative nurses working in an operating room. The job became increasingly complex. All of us know that. And we began to be faced with demographic challenges. Harder to get people to come into the profession. They don't get exposed to it pre-licensure, and we just have to face up to it. From what we know from the OR manager statistics, we're a pretty seasoned group that is leading the ORs now. As a rule, younger nurses don't see management positions in the OR as attractive. If any of you watch a television show called The Good Wife, there's a character in The Good Wife. She's one of the senior partners, and what they depicted on that show really illustrates what we're faced with here with young perioperative nurses. Diane is a senior partner. She wants to mentor a young lawyer and bring her up and groom her to eventually become a partner in the firm, and makes an offer to a young female partner and says, I would like to be your mentor, my goal is to bring you along, etc. And that young lawyer said, does this mean that I have to put in more hours at work? Because, I'm in a long-distance relationship, I don't want to sacrifice my relationship, this is all very important. And Diane was taken completely aback and never anticipated that response. When we talk to young nurses about what do you think about going into management in the operating room, not unusual for them to say, truly what you do doesn't look all that attractive to me. I like to come into work, I work hard, I put in my time, and I really don't want to spend 50 or 60 hours a week in the operating room dealing with the kind of issues that you have. So not easy to get people to recruit them into the OR management ranks, and we have very seasoned, mature nurses leading a mature workforce. Our work is becoming increasingly challenging, and now other professions and types of providers are now in the mix. Not unusual at all that anesthesia providers are in the management ranks in the operating room. So how does CCI see all of this, and where do we come in? So let's give you our perspective. Let's think back 30 years ago. I was still in nursing school in the mid-'80s. I would graduate in '85, and diagnosis-related groups, that whole concept was coming into being at that time. Diagnosis-related groups, I remember being clinical at the diploma school, and experienced nurses were telling me this is the end of nursing as we know it. And this is all going to be about finance, and they're going to give us a set amount of money to take care of a patient, and nursing's going away. Well, I have to tell you, it's 2015. That was 30 years ago or so. And you know what? nursing survived. There's 3.2 million nurses in the United States, and we're the largest and most trusted healthcare profession in the world. So we figured it out, we adapted, and we're doing pretty well. There's a similar, almost seismic change going on right now if you're an OR manager. And I call it the new financial environment, and this is my diagram. So we now have to deal with things in 2015 like value-based purchasing, changes in reimbursement, and now they're actually focusing on things like quality. So it's not just the number of cases that you push through, but rather the quality and how many complications did they have, what were the outcomes for that patient, not just that they had surgery and we can bill for it, but now there are things like financial disincentives that if you get a poor quality outcome like a surgical site infection, you may not get any reimbursement for that case. That is a whole new environment, and it requires us, once again, as nurse managers and leaders, we have to adapt to this new environment, and is every bit as disruptive as DRGs were in years past. In the OR for years, we have said that volume cures many ills. If you could get the volume and get enough reimbursement out of it, that would take care of a lot of things for you. And in some ways, that makes it simpler to run an OR. That get the volume, have a high patient rate, and push the cases through. In this new financial environment, that may no longer be true in all cases. So we've known for years that we've kept surgeons on that brought us volume, even though their clinical outcomes perhaps were not the best. Some of them had higher infection rates or more complications after their surgery, but they worked in services that had good margins, and they really brought us the cases. It's not necessarily about the volume in this new financial environment, and it's part of the reason that our role is changing. We have to learn new skills. CCI believes the work of nurse leaders in the operating room is changing quickly, and to be successful over the long term, you will have to engage in lifelong learning, and you're going to have to adapt to the pace of change. We believe that new skill sets will be needed to, if you want to be successful as an OR manager. We also think these skill sets can be difficult to acquire by on-the-job training, which was a big component in how many of us came to work and prosper in the OR thus far. We think it's going to be increasingly harder to pick this up just by OJT. Things like financial management and strategic management are going to become increasingly important, and this may require us to answer the question about what formalized training and education do nurses need if they're going to be effective leaders in the operating room. If you're now in a leadership role in this setting, you will need to engage in continuous professional development, lifelong learning, if you're going to stay current. We think that it's going to require new skill sets, so let's cover 3 examples. The first, and these are all very recent from the OR literature, enhanced recovery pathways. Multidisciplinary, standardized approach to caring for patients. We used to call these care paths. That was like the first iteration. Enhanced recovery pathways are like care paths on steroids. And multidisciplinary, and a lot of people involved. It involves a lot of collaboration and good communication, being used in an increasing variety of cases and services. And as facilities seek out greater efficiency, and they seek to avoid those unreimbursed complications, they're looking at things like enhanced recovery pathways. And of the 3 examples that I'm going to show you, there are 2 common elements to both of these, and I'll explain that after the 3rd one. Care bundles, seeing increasing use as we try to cut down on things like catheter-associated UTIs or central line-associated bloodstream infections. What we're finding out is a single intervention done in isolation is not the most effective means. bundling of care and a number of interventions being put together has a synergistic effect, and these sorts of things being increasingly used. The article that I cite is from the American Journal of Infection Control, and this involved total joints, and there are people demonstrating that using these bundle of care approaches that they're achieving great improvements in surgical care. And then finally, centers of excellence. And even though I can't see your nonverbals, some of you are probably rolling your eyes right now because centers of excellence don't always get a good rap. Some of them see these as just clever marketing ploys, but done well, the emphasis is on volume and standardizing in doing it in a relatively narrow range of cases. Orthopedics, bariatrics, these are very widespread. Cardiology, but again, finding increasing use. So you may say, so, what is the common ingredient of all these things? The common ingredient is, if you graduated from nursing school in 1985, like I did, these things didn't exist. And also, another common ingredient in all of these, in order to do well in these and for nursing to have an effective role, we have to develop new skills, and we have to become better at interdisciplinary, multidisciplinary collaboration and communication. These are things that not all of us got in nursing school, and even if you are a diploma grad, you went back and got a BSN 20 years ago, there are things coming out all the time that were not covered in your recent or your nursing education to date. CCI sees a professional development continuum. Let's consider all nurses. At the bottom of this continuum, there's certain things that all of us have to do just to work. You have to keep up with your licensure requirements. You have to do your workplace training that they assign you every year. Everybody has to do it. If you want to prosper and if you want to move up, you will have to exceed that. That might include some sort of continuous professional development, and this exists on a continuum. And so the next step, or further on a continuum, you'd have things like certification or further academic education, and then eventually you might work your way up to graduate level coursework or doctoral coursework. What CCI believes is it's time to just line this up for the operating room and say, if you want to be a manager in the operating room, a young nurse comes to you and says, I would like to get into management. Tell me how I do this. That we should have a set course for this, and then we can explain this to nurses and say, this is what you need to do. So let's say the young nurse comes up to you, wishes to work in the operating room and wants to get into management. The first thing is mentor them. Mentor their learning experiences or perhaps other staff members, but bring them along, encourage them, keep an eye out for them, and do what you can to keep them moving along. And then give them progressively more complex management and leadership experiences in a protected environment. So it's not a matter of when the person retires and then next week you throw them into the role, but rather you've been grooming them and bringing them along, anticipating that opportunity would someday present. Then the next step, very likely, depending on the needs of your organization, is some sort of additional formalized education. That the first step may be a bachelor's degree, a BSN, but then eventually, increasingly, it's graduate level education. And also, if you want to get the basic foundational knowledge, we believe that is found in the fundamentals of OR management, based on a job analysis of what OR managers do. That's self-paced learning. Or you can go to a conference and listen to the presenters, give you more detail, and basically it's a textbook on how do you manage an operating room. There's not a wealth of good text out there on this subject. Probably the best that's out there is a book by Kay, Fox, and Ehrman. Those people are not nurses. It's a great book, It's one of our references for the exam, but those are anesthesia providers. So the best that we have, we think it should be based on a job analysis, and that's what the fundamentals of OR management is based upon. And then finally, you're going to have to continue on the professional development continuum to be successful. You're going to have to engage in lifelong learning and do continuous professional development. That may involve certification, it may not. It is entirely possible to do this without being certified. But there are some advantages to being certified. But my point is you should have a professional development plan and a logical, consistent way to go about continuing your development if you're going to continue on in the operating room in a management role. We believe that OR management requires transformational leaders that have the ability and the insight to coordinate patient throughput with a collaborative team. This is from our materials. We believe these are the skills that you're going to need to be successful in working in things like these enhanced recovery pathways. When you say, what does this all mean to me? These recent developments, like the enhanced recovery pathways, care bundles, centers of excellence, were not covered in your pre-licensure education. And if you went back to school, and it's been some time since you did that, they weren't covered even when you went back for your BSN and your MSN. They weren't for me when I did mine in the 90s. We think that professional development and lifelong learning will become increasingly important. And it's unlikely that if you get into management with an ADN or a diploma, like I did when I started, it's unlikely that you're going to be able to finish your career at the education level that brought you into nursing, your pre-licensure degree. There's nothing I've seen in the literature and in the information, the demographic information that I have, that leads me to believe otherwise. We see professional development as something that maintains and enhances your competency. And in this changing financial environment, to maintain competency as an OR manager, as people like Patricia Benner describes it, is going to take work. We believe that this statement, which comes to us from the Scope and Standards of Practice for Nursing Professional Development, CCI believes this. We believe in promoting professional development. We believe that certification is one element of professional development, but we believe you need to do that in a meaningful, consistent manner to maintain and enhance your competency. How does certification and professional development come together? And I can tell you this image here has special meaning for me. This is an image from the Toledo District Nurse Association, and I found this in the National Library of Medicine. So a home health nurse working in Toledo, Ohio, many years ago. Here's where we see the future, and this is where I wrap it up. We think nursing certification is going to change. Nursing certification will be one possible part of your professional development course, but it's going to look different in the future. For those of you who hold a current certification like CNOR, CSSM is different, and CSSM is what the future will look like for certification. Number one, there's a higher bar for eligibility. You must have a bachelor's of something to take this exam, and that reflects the fact that 80% of the people that manage operating rooms these days have a bachelor's or higher. Also, you have to have 2 to 4 years experience. You are not required to hold CNOR, because even though that may be helpful, there is no common elements between CNOR and CSSM, so you're not required to hold CNOR to take this exam. You also must have either recent academic coursework or CE. You must have a number of 30 to 50 CEs in management-related topics in a 2-year period before you can sit for that exam. That is very much different than CNOR. Once you hold the certification, you pass that exam, you will get a personalized professional development plan. So we're going to partner with you to help you with your professional development. What you need to do to maintain that certification, which is good for only 3 years, because it's tied to the length of the job analysis, will be based on how you scored on that exam. So your knowledge level in each of those 7 subject matter areas will determine how much work you have to do and in what areas. So let's say you take the exam and you score poorly in leadership and communication, 2 of the 7 areas. Part of the professional development work that you do will have to be in those areas in order for you to maintain your certification. And the other thing is, no matter how well you score on the exam, no one will be able to maintain their certification by turning in CE alone. So unlike CNOR, where you could go to the end of your credential period and then do a bunch of CE and hand them in, that will not be the case for the CSSM credential. This statement comes from the IOM report on the future of nursing. We very much believe this also, that the ultimate goal of licensure, accreditation, and for us particularly certification and education is to promote patient safety and public protection. We believe that professional development, lifelong learning, and going at this in a methodical manner is the best way that we can contribute to your competency level, which ultimately contributes to safe patient care. So we're very much in alignment with this statement from the IOM report. Here's what we see as the future state. You'll be faced with a choice. If you're managing an OR now, you'll have a choice. You can stay on your current path and not have a real firm plan for your professional development. Take your opportunities as they present, some great content at OR Today Live or Surgical Conference and Expo, but not really have a well thought out plan. And in some ways it's a bit reactive, but we think over the long term, if you stay in that course, you will have less and less opportunities. And you also have a risk that your skill set will become obsolete. Or to become more proactive about this and engage in lifelong learning and continuous professional development and have a meaningful, well thought out plan to do that. Certification may be part of that. It may not. It may not require you to get further academic education, but that could be part of it. But we think overall there'll be a greater emphasis on continuous professional development and lifelong learning, and that's how we're going to stay current and maintain our competency in this very fast-changing new financial environment that we're faced with. So, Jamie, that concludes my presentation. I think we brought it in just under an hour. And thank you. And at this point, if you have any questions,
thank you.
I'll start answering them.
Great. Well, we had a couple that come in, but of course, attendees, you're welcome to continue to submit your questions at any time. We'll get through as many as we can today. But Jim, the first one is, if I do decide to return to school for more education, what degree should I get?
Well, that's a great question, and I think that opens up the window for you to go to whoever your supervisor is, and let's say it's a senior nurse executive, it might be the chief of surgery, it could be your administrator, and have a discussion with them about your professional development goals. And I think to just level with them and say, I would like to advance in the organization. How does the organization see this? What skills, what education would be helpful, and how should I go about this? They may have an idea, but it opens the door for very good conversation. If they don't have suggestions or guidance for you, then it gives you the opportunity to lay out your case for, I believe the best way to go about this could be an MSN with an emphasis in clinical services administration, In the local university, they're very strong. Their faculty has a very strong background in financial management, and that's my course that I wish to take. And, you know, will that work for the organization? If nothing else, out of that conversation, if they can't give you firm guidance, if nothing else, you've let them know that you're interested in furthering your education and your professional development, and I think that'll be a positive right there, even if they don't give you a recommendation about, you know, which degree you should get.
Very good. Next question. Why should I now get a certification in OR management?
I'll be quite honest. Getting a certification in surgical services management will not fit everyone's career path. If you take to heart this message about the need for continuous professional development and lifelong learning, and you'd like a partner in helping to increase your competency and increasing your knowledge levels, the CSSM credential will do that for you. We will lay out a course for your professional development, and we will help you along that path. You may find benefit in that, or you may decide that you can work this out on your own, and you realize the importance, and you'll figure out your own course. The ultimate goal of the CSSM credential is to have something equivalent as CNOR is to the clinical nurse. CSSM, we hope, will eventually become that for the people that are in management and leadership, and our goal is to, once it's eligible, to also get that credential accredited. So if you're working at a magnet facility, that too would count on the certification scoreboard. So we can partner with you, we can aid your professional development, and we can provide you with a lot of resources if you were to do our credential. That's some of the advantages of doing the CSSM credential.
Great. Next question. I have my CNORs. Do I need to have the CSSM certification also?
So if you currently hold CNOR, there's no requirement that you hold CNOR to take the CSSM exam. But so let's start with a nurse that has a BSN and holds a CNOR. That nurse, in order to be eligible to take the exam, would need to have 2 years of management experience, 30 CEs or 2 college courses in management-related content before they could take the exam. And then also the thing about you must have a clear license without restrictions, etc. If you don't hold CNOR, you would need 4 years of experience, 50 CEs, or 4 college credits. So you have to do more if you don't hold CNOR. They are 2 separate credentials. So you can hold CNOR and maintain that, and then also go on to get CSSM and maintain that. We anticipate that some people, once they move into the management ranks, will no longer hold CNOR. They'll earn CSSM and they'll keep it, but nothing prohibits you from holding both CNOR and CSSM. You don't need to relinquish CNOR in order to hold CSSM. We believe that the CNOR validates your clinical knowledge, and the CSSM will validate your knowledge of management and leadership, and that they're a great combination. But you don't necessarily have to have CNOR to take the CSSM exam and be successful.
Great. The next question we have is, why is the CSSM credential only good for 3 years?
When you have an accredited credential, as CNOR is, there's certain requirements for that accreditation, and one of them is you have to be able to establish for the surveyors, the people that evaluate your program, that there's a sound basis for this. One of the criteria they will look at is what is the pace of change in that profession, and if the pace of change is rapid, they want you to basically check the knowledge base of that profession, that role, at a more frequent interval. From everything we know about managing an operating room and all these things that are coming up, like changes in reimbursement, enhanced recovery pathways, this sort of thing, the pace of change is rapid. And so for now, it's every 3 years. That could be cut further in the future, even though it's very expensive to do it that way. But for now, it's only 3 years because we believe the pace of change for CSSM, for managers and leaders, is more rapid than, from what we know, than it would be for a clinician. That's the reason it's tied to the cycle for the job analysis, and they're mutually reinforcing.
Okay, Jim, we have one last question, unless attendees would like to submit additional ones at this time. But for now, is it realistic to think a non-RN would get an opportunity for a manager, director, senior director of surgical service position?
Yes, it is, and I can tell you that we talk to a lot of OR managers when we do our education courses. Jamie, was the question, is it realistic?
Yes.
Okay, I don't know, realistic, I would have to drag some of my own values into there. I have my own thoughts on this. I can tell you that it's happening, and I believe it's happening for two reasons. Number one, somewhere up in the leadership chain, they realize the importance of things like financial management, strategic management, et cetera. And the people that are not nurses, I think, bring a strong background in that. And the people that are making the hiring decisions, their priorities are such that they believe that they can handle the clinical part will somehow get accomplished by someone reporting to probably the clinical coordinator, the manager, and the finance and the other leadership stuff will be focused on the director, who may not be a nurse. That's a big change, a big paradigm shift. The other thing is there are many open jobs right now for OR management and leadership. If you're in the OR right now and you attended Surgical Conference and Expo or a trade show, you're probably getting bombarded with recruiting things for interim leadership. Are you interested in a position here? We have a lot of open positions. If we don't figure out in nursing what we have to offer and make our case and really solidify our position, we take a risk that others will answer the question for us. And so perhaps a healthcare administrator would make the case, you know, I deserve a shot, I have a strong financial background, and I think I can do it. And then if they have a difficult time filling a position, they may give them a shot. It's not in our best interest as a profession in nursing to stand by and let that happen. If we want to preserve our own place in the whole scheme of healthcare, we should address the issue, and I think some of that falls to us as a profession, that we need to answer the question, mentor people, bring them in, and demonstrate our value. Because in a new financial environment, saying we've done it this way for years, we've always had a nurse be the manager, and we need to continue doing that, and we can't fill in the value proposition, doesn't make a convincing case for us. So some of this I think we have to own. And I can tell you, someone that's managed operating rooms for a long time, I have a hard time seeing it, but I just have to face the reality of it is happening. And so we have a choice. We can respond to that and address it, or, you know, we can continue to watch it happen. I choose to take the former course, which kind of drives a lot of what I do at CCI, is I think we need to establish the value that we add.
All right, Jim, right now that's all the questions that we've had today. I certainly thank you for your time and the wisdom that you've shared, and of course, big thank you to the CCI for sponsoring today's webinar. Attendees, remember you can learn more about CCI by visiting www.cc-institute.org. Also, remember to obtain your certificate of attendance. You must complete the post-webinar survey at the conclusion of today's presentation. The survey will appear immediately on your computer screen. Certificates will be emailed on or before December 10th. And if you do not receive the survey, please email us at webinar@mdpublishing.com. Thank you for attending and enjoy the rest of your afternoon.